In the United States, nearly 90% of American citizens have felt a sense of stress, lack of focus, loneliness, chronic pain, and the list goes on. The rise in numbers of individuals who have psychiatric conditions such as depression, anxiety, or post-traumatic stress disorder are reaching substantially high numbers. Following the pandemic that took over our lives in March of 2020, the amount of people who are obtaining these conditions has increased over 10%. Now so to the point of wondering what we can do to bring our society members out of this mental health crisis and back to a well-driven environment. As we work towards improving the mental wellness of our communities, people have sought out numerous mechanisms to help derive the symptoms. These consist of antidepressants, cognitive behavioral therapy, exercise, diet changes, and countless other options, but becoming more popular is the use of cannabidiol, which is more formally known as CBD. CBD is in cannabis sativa, but it doesn't obtain the psychoactive effects, likewise of its counterpart, tetrahydrocannabinol. CBD and THC are substances that are in marijuana. With that, there are over 500 substances that are in marijuana, but only a few of these have been researched on. Cannabidiol and tetrahydrocannabinol being two of them. With that being said, a study in 1980 found that mammals and humans have receptors for cannabidiol. The usage of marijuana contains different amounts of THC and CBD ratios. Research has shown that with a higher dose of THC, you have less side effects and more significant results in therapeutic factors. Marijuana ingestion produces a sense of calmness and contentness, which is similar to exercising and social interactions. There was a study of 1,746 patients in which 55.1% improved in relaxation, 37.8% stated that marijuana relieved anxiety, and 16.9% had a relief of panic attacks. These results are only obtained through individuals who have acute marijuana usage, whereas someone who ingested cannabis regularly will not have significant results in regards to relieving symptoms. Yet it also states that marijuana could have a beneficial or a harmful effect in relation to mental wellness. Evidence found in 1980 suggested that the endocannabinoid system does play an important role in gating and buffering stress response, regulating moods, and relieving anxiety. There is a receptor known as the CB1, which if blocked is what produces depressive symptoms. Therefore, if we activate CB1, it could have a positive response and alleviate depressive symptoms. The CB1 receptor influences the activity of both central and peripheral neurons, which are implicated in anxiety and averse learning processes. Specifically, it modulates neural circuits in crucial brain regions, such as the hippocampus, amygdala, and cerebral cortex. Recent findings underscore the central role of the ECB system in regulating adverse memories, suggesting its potential as a therapeutic target for conditions characterized by persistent recollections. There was another study on 1,429 medical marijuana users in which reported that just over 50% used their for depression and found improvement. Although when considering using marijuana to treat depression, it is noted that regular use of marijuana can induce the risk of depression and cannabis dependency. On the other hand, in regards to PTSD, which is developed through inadequate adaptation to a traumatic event, using CBD is significantly adequate because of its ability to block reconciliation and remove adverse memories. In essence, it pertains to the ECB system, which has emerged as more efficient and resilient mechanism for coping with PTSD compared to alternative approaches. Moreover, research delves into how various receptors can be modulated, alternative pathways of action within the body, and the optimal dosages of CBD versus THC to achieve these therapeutic effects. However, further researches are warranted to reach a definite conclusion regarding the suitability of CBD as a novel intervention for individuals grappling with PTSD and anxiety-related disorders.